Janagar. Today we have with us Dr. Sekhar, Lead Consultant, Plastic, Aesthetic and Reconstructive Surgery at United Hospitals, Janagar. Welcome, sir.
Thank you.
Today, sir has chosen the topic of fire safety and burns to create awareness among our public. Do you want to speak some words about it, sir?
To start with, I thank all those who are participating in this program. Burns is a situation where man has found from the day the burns has been discovered. So one has to be more careful in preventing the burn than treating the burn, because burns involves a lot of problems. One is pain, one is misery, one is cost, and the most important, loss of function and the figure. So prevention is best than the treatment.
What is a burn injury?
Anything which is hot fluid, flame, acid, radiation can destroy the skin. This depends on the temperature, whether it falls on the bare skin or on the cloth, depends on the depth of the burn. So one has to be careful with all the precaution to avoid burns.
What are the different types of burns, sir?
Burns are flame burns, then the hot burns, which occurs mostly on children because of their innocence, and they also touch the hot objects. That is one. And sometimes the people who are angry against somebody, they throw acid. That is another way. Then the radiation burn, and nowadays if we see, there are a lot of disturbances among the country. The explosions can also cause the burns.
In continuation to this, what are the layers of skin, sir, that can get affected by burns?
Skin has got important superficial epidermis and deep dermis. The epidermis is the one which gives the color. The dermis one is the one which gives protection to prevent infection, and it controls the temperature. Another important part of a skin is the sensation. If we didn't have a sensation, we would be losing our parts whenever we exposed to the burns.
How to measure severity of burns, sir?
The severity of the burns are measured superficial, second degree and third degree. Superficial is one which has got burnt only the epidermis, that is the color bearing superficial part of the skin. This can be neglected, but it only causes pain. It doesn't need treatment. Even a sunburn can be a part one, whereas the second degree, which involves part of the dermis, which heals without a problem. When it's a third degree, it will involve the full thickness of the skin, or even it can go deeper. This is the one which causes a lot of problems, and sometimes if it is extensive, it will cause death.
What is the first thing one should do after they get burns, sir?
Now, that depends on what type of burn they are. If it is a flame burn, they should immediately put a clean water for 2 minutes so that they extinguish the fire, reduce the pain on the victim, and reduces the extent of burn. One thing, when they are burnt, they should not run away. When the clothes catch fire, they should stand still, roll down, so that they will not suffer an inhalation burn that will cause more problem if the lungs are involved. Now, when it comes to the acid burn, you should be careful that you should not keep in the reach of the children.
Compared to the area of the body, how to measure these burns, the severity of it?
Yeah, in an adult, it is the rule of 9 that makes a treating doctor to assess how much of fluids he has to go, what are the measures he has to take to improve the life. The hands, right and left, 9 each. The legs, 18%, right and left. Chest and the abdomen is 18%, and the back is 18%. head and neck is 9% and genitalia is 1%. In children, the head circumference is more. As you can see depicted in the chart, this is 18%, rest all or goes according to the chart. Using a chart to estimate the burn and also the depth of the burn is very essential, and this is standard followed all over the world.
For the temperature of
The, depending on the temperature, the various level of burn occurs, mainly whether it is mostly that is a moist heat. When it comes to a flame burn, they are always higher. The maximum depth of burn caused by the molten metal, because that is at thousands of degree centigrade. That is the worst. One cannot save anything from them. Thank you.
the very first thing to do if someone suffers from burns, sir?
Yeah, the one thing they have to do is they should never panic. It is easily said than practiced. Because whenever a sudden explosion takes place, sudden flame comes in because of petrol pump or at the how the gases was leaking, you will get panic. So don't panic. Just try to look for a water and pour water wherever it is. Then you crawl on the floor and see that you will not burn on the lungs. When it comes to the acid burn, again take the patient to the tap, let the water run on the acid burnt area, remove the clothes. When it is more than 1%, rather more than 9%, take them to the doctor. Depending on the acid and the strength of the acid, the depth of the burn depends.
If it's a scenario for smoke-filled rooms, sir?
When there is a smoke-filled room, the smoke which is lighter or is at a higher level. So one has to crawl on the ground and go. Preferably they should have a wet hanky onto their nose and mouth, because the flames, flakes and all gets into the lungs and can cause obstruction and cause tracheal edema. So preventing the lung inhalation burn, better crawl and reach out of the scenario.
If there is a case presentation, sir?
Yeah, this is a patient. I have brought this up so that people will get some interest. Otherwise, they get bored only theory. So here is the patient who had a post burn. He was not much. So we take a sheet of skin and put that skin on the burnt area, and the donor area we cover with a collagen sheet. This can be left open, and this heals without a problem in about 2 weeks, and the graft also takes well settled in about 2 weeks' time.
If there is a fire scenario at home, in the house, what to do?
The fire scenario at home, because of so many combustible things, the gas produced is more of carbon monoxide and carbon dioxide. So you first crawl and get out of the house, call for help, never ever get into the house again. You may be having a lot of valuables, but your life is more valuable. So this is one important, and don't forget to call the fire engine for extinguishing the fire. This is very important. Don't be obsessed with the material what you possess. You can earn anytime, all the time. Save your life.
Next, we would like to know about electrical burns, sir.
Yeah, electrical burn. Again, most often the children, out of curiosity, hold on to the plug into their mouth, and there are many children who are burnt on the face, on the lips. Never put water when there is electrical appliances. Put off the electrical appliances and switch off. Then call for the right people. Use the right standard material, otherwise it can go for short circuit. Even when nowadays we all know mobiles working, it can explode, so also the laptops. One has to be careful. Throw away and run for rescue or run for safety.
What if clothes catch fire, sir?
Yeah, most often it happens when a woman is cooking in the kitchen with the loose dress. That can catch fire when they turn and climb up to pick up whatever is stored. That is one bad thing. Another thing is, I had a girl who was 12-year-old, weighing only 22 kgs, with a long hair. She was so conscious and so possessive of her hair during the Deepavali. She turned by a side and the whole her hair got fire, and she had 30% of burn, and tried a lot and she survived, and now she has got 3 children. And one should not get into that scenario, because this girl burned all her back but not the front part of and the face. Somehow the parents took care of her well, and it went on well. Don't ask how much money they spent. They spent nearly 90 lakhs. Do one has to be careless with fire? Please, never ever.
Another scenario, sir. If one returns home from work and they smell of cooking gas in the house, what should they do?
Yeah, this again I would like to give an example, because you all know the cooking gas is highly inflammable. You see, this happened 10 years back, and a grandma was very happy that her grandchild was becoming 1 year old, and she got up early. Whether she knew or she didn't know, she was doing all the rituals to praying the God. Once she put the light on, her matchstick on, the whole house caught the fire like a shot, and the child which was sleeping, it got burned. Unluckily, the child couldn't be saved. So when you first smell, never put the switches on. Open the doors and the windows. Again, don't put the fan, because you will be creating a spark.
Another case scenario, sir.
Yeah, this was a girl who got electrocuted because of her carelessness. Came to me with a post-burn contracture. That scar tissue was removed. A skin graft taken from her upper arm was applied, and at the end of the day she could straighten and flex the finger. Though it is only one finger, but it is the right hand. What a misery! She can't shake hand with somebody because she feels uncomfortable. She feels depressive. So that is one of the reasons why burns has to be prevented, not treated.
I think we have covered most of the causes of prevention. What about first aid and treatment, sir?
Yeah, first aid, whenever there is a burn, if it is a minor burn, you help yourself. If it is a flame burn, throw water, and always keep a bucket of water when it is there. When the person is involved, pour water on the burn. There is a dictum, if you put water, there will be a bleb. It is wrong. Let the bleb will come whether you put water or not. Bleb comes because the body fluid will come out when there is an outer layer of skin is burned. So the misconception of not pouring a water or pouring a water should not come into the picture. You should always put a cold running water, a clean water, not a dirty water. You should put a clean drinking water or a tap water to extinguish the fire.
Another case scenario, sir.
Yeah, this lady was the victim of acid burn, and I had to do 8 surgeries to get into this figure. I am happy for having reconstructed from what she came for and what it is. But to think really the lady would be happy? No, that is where the misery and the suffering with the mental is so much with the burn. Our goal should not only success by service, but service for a burn patient, it goes on a long, long way.
First aid in burns, sir.
Yeah, again, we have repeated just nothing but cold water. But whenever you touch the burn, you wash your hand. The one who is going to help, wash your hands well. Put cold water and drape a iron towel or a iron hanky and take to the doctor. You don't apply ointment, don't apply turmeric, don't apply toothpaste or ink, because that will mask the assessment of the and extent of burn by the doctor. At the most you can give some painkiller if you have paracetamol, or you can give a little bit of water to drink, but don't make them eat anything.
What about in case of serious burns?
Serious burn, call the ambulance and please shift. When you are shifting, take out all the valuables, otherwise when the patients are burnt, the edema will come up, and at that time valuables are difficult to remove from the body.
Next will be a new concept, safety measures. What about safety measures that one should take?
Safety measures, when it is a flame burn, nowadays everyone puts the crackers, whether it is a housewarming ceremony, whether it is a political ceremony, is there a victory, and even on a birthday. One funny thing in birthdays, they put a balloon full of a gas and colored material, and they poke with the incense, burning incense. I have seen parents with the child, 1 year old, getting flash burn. Why flash burn? The gas, when they poke with the incense burning, it will explode. So all your joy and pleasure is lost when this. Be careful. Whenever during crackers time, keep a bucket of water by the side for the safety part.
Another case scenario, sir.
Yeah, this is one of the engineer. He wanted to make his sister's child happy, holding a flower pot in his hand, and it just exploded, and he has to undergo surgery. So never ever play with the crackers. They don't have senses, but we have to have sense to see that we use it with care.
Safety practices during cooking.
Yeah, nowadays everyone knows they cook at the higher level. They wear they don't wear a loose dress, and that's how they can prevent. Anyway, whenever there is this electrical, put off the electrical or put off the stove and put yourself some clean water. Thereby you will reduce the pain and the extent of burn. Crackers. It is the children will do what we seen in the TV screens with the what do you call that cartoons. You can't play cartoon games with the crackers.
Firecrackers.
Crackers are always crazy. So put the crackers. If it is a rocket, put it in a bottle which goes up, then it reverses on you or on your friend. Every crackers day you see so many children are going to the ophthalmic hospitals for their injuries onto the eye. Be careful, never ever do that, please. And never ever crack inside a room. When you put a big bomb, you put a lid covering on that, it can go anywhere. These are all crazy things. It is easy to see on the TV screen, not on the real scenario. And whenever there is a plan your escape. Never ever enter the house in a flame. because you will not be able to come back. And of course, the laptop and the mobiles and putting water onto the electrical things, they're all dangerous. You all know why you miss is in the panic. So the moment you go panic, you go haywire.
The do's of burn prevention at home.
Always keep the cooking stove on a raised platform. Keep matches, candles, inflammable out of reach from children. Check temperature of the water for bath, especially if it is to be a child. Unplug all electrical gadgets when not in use. Use only a standard electrical appliances. The don'ts.
The don'ts.
And never wear a synthetic dress. Synthetic dress burns at a higher temperature, though it catches fast and sticks to the body. If it is a cotton, it is comparatively resistant, and a synthetic at a higher temperature, when it sticks to the body, it causes more deeper burns. Again, it adds to the mortality or death rate in a burn. Yeah, 2 weeks back I was in Vietnam. It was a holiday, we were taking a walk. You will be surprised to know how that small country was educating the children how to extinguish the fire and how to avoid burns. Here, the child is running. The child has come to the place, that extinguishing. You see the child pulled out something. That is the key they have put it. Because it's a child, the fire extinguisher individual is helping the child. Before the child reaches to the flame, the extinguisher is on. That is where the child is protected. It's all finished. Okay, we in next one also slide. Yeah. So no. If you stop, I'll show. Yeah, you see, this is a door, and 1, 2, 3. These are the obstacles. Why these are shown? Whenever the fire happens, it just happens knowingly or unknowingly. One has to pass through the obstacle, open the door of the house. Again, the time is taken. Then he has to come running to the place where the extinguisher is there. Now, extinguisher, just having the extinguisher is no use. You should know where to pull out the plug, and then where is the switch to put it on, and then only you can run and put it. Now you please watch the video again, you will get to know. Of course, the child has passed through the obstacle and the chair, and the gentleman is helping, and he has started putting on the extinguisher earlier itself, before the child goes. Otherwise, you will be suffering. So, with all the care you have to take, so that you will help others. If I don't take care of myself, I can't help others. Now, coming back to skin donation.
It was a very new concept for me also, sir, about skin donation. So, I think many of us are not aware that skin can also be donated, just like donating the eyes or like internal organ parts that we are more aware of. Kidney transplant, kidney donation it's a more spoken about subject. But skin donation is not really spoken about as much, so sir will speak more about it.
Skin is an organ like any other organ of the body. It gives good appearance to the individual. Sensation is very important part of the skin, which prevents injury and infection. It controls body temperature. If you ask me, skin is the biggest organ of our body. Skin donation, if given, helps to save the life of a burn victim. Once we treat severely burned patient with more than 40-degree burn, depending on his age and good health status, suppose we take another 10% of burn on only that 40% burn, the total surface area of the burn becomes 50. So when it is difficult to treat a 50%, 40% burn, we will be adding another 10%, adding problem. So what we do, we take the skin from the dead individual within 4 to 6 hours, and we store it in the, there are so many processes how we store it. Once the stored skin is there, we will apply after a week on the burnt area, because by the 4 days of time the extensive burned individual would have recovered with the treatment. Excise the dead tissue and put this stored skin graft. This skin graft stored will prevent the burn, pain and also water loss. During this loss only for 2 weeks, because it is a homograft. Though the mother only gives, it doesn't hold for long. Skin is really very antigenic and its rejections are very fast. So every 10 days, if we have to keep the patient alive, we have to keep changing the donor skin, because the same donor cannot give the same to the same individual. So this skin, when it holds on for 10 days, the condition of the patient improves. Once its condition improves, then we can take the remaining skin from the same victim and spread it like a mosquito net and cover it up. This will take better, and thereby we can achieve a good result when it comes to the burn. Only Victoria Hospital has the facility to take, store and use the donated skin on the burn victim. This message is important for me to enlighten you. Just like heart, kidney, one develops, one donate, one can also donate skin. So please remember, whenever there is an occasion like eye, kidney, please donate skin also. You can call Victoria Hospital and get the more details.
It was a very interactive session. If anybody has any questions for another 2-3 minutes, we will take some questions directed to Sekhar sir.
Thank you.
Thank you so much. Thank you. I hope it was an informative session. Thank you, sir.
Thanks. I wish you all happy Vijayadashmi and happy Deepavali. Thanks for listening and your patience.
Thank you.